So karibuni sana to this what you call product privacy, by extension demonstrating practical privacy by design. So just quick gist of the topic and why it's important and why I thought I should submit a call for, I should make a submission for the call for speakers. So one, we all know product. Product is a very common word. We all know what a product is. All of us are wearing products. All of us are sitting on, standing on, everything around us is product in one form or shape or way, right? Privacy, again, a very, very straightforward concept. We all know privacy. It's as easy as the right of being left alone. No one should mess with your bubble. No one should get into your space without you allowing. A very straightforward concept. So combining those two, we especially now have to consider how do we think about privacy for all the products that we use, right? And especially digital products, because now we are talking about digital everywhere, digital services, digital infrastructure, digital governance, data that runs through the digital infrastructure, etc. So then it's important to think, as much as we value privacy, how we interact with the world and other people, how can that privacy be considered or be embedded within the products that we use, particularly digital, as I've said. So here today we are here to on one mission. It's going to be a bit technical, but again, if you get 3 or 4 or 5 things, that's good. That's good enough. So we're here to just demonstrate or illustrate or appreciate how then we can take this abstract concept of privacy, this legal concept of privacy, this governance concept of privacy, because governance is not something you can hold like this, but a product is something you can hold, including your refrigerator that is smart, your TVs that are smart. All those are digital products, and they all need privacy in some form or shape, right? So we want to demonstrate how you can then, when you're interacting with these devices, all these abstract concepts, how do they come to life within a digital product, right? Or a physical product that has smart digital capabilities. So as I've mentioned, that is in short who am I professionally, but of course I am definitely more than that. So first, high level, because we have a short period. I thought we'd have an hour and a half, but time will so I'm going to run through the stuff that don't matter much and then focus on the stuff that do. So one, it's always good to appreciate data protection and privacy. Again, things we've had, I think since morning, we've had in many forums in organizations, we've gone to many conferences, very more or less straightforward concepts. But a few things I'd like us to note. Data protection is not the same as data privacy. Think terminology, think English, right? But the gist of it is that privacy is more or less the more abstract concept that just says you need to be left alone, right? You need to think independently, be independent, do your own thing independently, as an individual, as a unit, as a person, right? So in essence, that's privacy. But then now we have data protection and privacy. I always say data protection is an extension of privacy, but some would do the reverse. But for me, data protection is a combination of a few things. First is the privacy itself. Second is security. In this case, you're talking about digital and cyber security. And then now a combination of all things ethics and legal. So if you put all these 3 things together, then you have this enforceable concept called data protection. Yeah? So this table here just sort of gives you a distinction across the various aspects or attributes. And probably will share the slide that you can read. But what I'd like us to think about is this objective here. So for example, let me start with privacy. So privacy here is to ensure individuals' rights are respected, giving them control over the information. So control over what we call agency is the essence of privacy. Whether you have digital, whether you have laws, you don't have regulations and all that stuff. Even before the Kenya Data Protection Act, we still value privacy. After all, privacy is a fundamental right in Article 31 in the Constitution, right? So it did not necessarily need a Data Protection Act for us to value privacy. such a fundamental concept. Now, if you look at data protection, objective key here is to ensure that our data remains protected from any form of violation, right? Violation could be technical, violation could be administrative, violation could be social, etc. So in essence, for us to be able to ensure this protection, laws and regulations help us to provide that protection in a very formal way. Yeah? That is why companies have obligations. That's why you have all the requirements of the Data Act that says as a controller, as a processor, you need to do this, you can't do that, and all that stuff. All those are forms of protection, right, from a legal standpoint. But anyway, just to appreciate that normally in our context, we do data protection and privacy together. And because we're here to talk about the hard stuff, let's think about privacy by design, and then also talk about data protection by design. Again, two different concepts, right? So as you can see here, let's start with here. This is PBD, privacy by design. So there are normally 7 foundational principles to privacy by design. Of course, by design, anything by design really is just about saying we are taking that thing X and we are building it in products, in systems, in services, in processes by design. So whenever we are building something, we are considering privacy during the build and development process. So here, as you can see, we have very key 7 principles for what forms privacy by design. I'll discuss it kidogo as we go. This is a lot more principled and technical. While for this other side, which is now the data protection by design, I think if you read it through quickly, you'll notice is your kawaida legal-oriented maneno, right? So things like fair processing, lawful processing, right? Limited purpose, adequacy, accuracy. So, it fits a lot to what the data protection principles are. So in essence, what we mean is that, what I'm trying to say is that it's useful to distinguish some of the more technical, techno-operational aspects, which relies a lot on the privacy by design, vis-a-vis some of the more governance aspects that are related to data protection by design. Again, just to appreciate. Now, if you read the description of this workshop, if you did, but if you did not, I'll explain. My goal today was to help you guys appreciate technical aspect of privacy from a privacy design perspective, using the use case of a healthcare technology application. I know we have a health informatics person, we have guys who deal in research and data as well, and related. One of the key areas of interest right now, and I think I've had it this afternoon in the main hall, is these issues of digital health, right? In all forms or shapes. It's a whole ecosystem, of course, with many different components and players and all that, which health tech is one of them, right? So I want to use a kawaida healthcare technology application, mobile application, web-based mobile application, to be able to demonstrate how you can think through embedding privacy and data protection aspects in an application. Remember, at the end of the day, the law only goes so much, right? The law only goes so much, but at the end of the day, what we use on a day-to-day basis are products. Yes, they need to work within a regulatory environment, but actual enforcement, I would say we need to take it further from legal, right? Legal level. We need to take it down to product level, and then we now dig in properly, into things like code. How do we enforce these legal requirements in code, right? How do we enforce these legal requirements in our architectures for products and systems and things like that? So work with me through this. So I'm going to use a health tech application as the use case. So first we have to appreciate what is a health tech app and why it is important, right? So again, your typical health tech application would offer these services. Things like MTBA, SafariMed. I don't know if you guys know any or use any, but there are a bunch of them out there. If you do a quick Google search, you will see most of them have this. Most of them have the same services. So they give you remote access to doctors. Period. Right? You can do consultations. They help you to schedule consultations, help you to order drugs. They can help you with some sort of partial or quasi insurance where you can save money instead of using your preterm. You can save money these applications and use that money for when you're sick. And points, redeem those points and things like that. But essentially, it's just to provide you remote medical access. How it works, you can think of it in 3 ways. So one, before I go to how it works, let's look at why then. Sorry, I think I've mixed up my slide. But anyway, how do they help out, right? So we are using digital technology to deliver health-related services, or healthcare services, in that sense. And we are doing this remotely because it is more like a last-mile access, if you think about it, right? Or convenient access to healthcare services. So it helps with medical visits. You don't need to always go to hospital. Same way you don't need to go to your bank right now. You're using your mobile application for banking. It helps with remote patient monitoring. So you can monitor patient use at home. If you give them the right tools and infrastructure. It provides education, helps you to self-care, right? Instead of always going to the doctor, you probably can share notes with a doctor somewhere, instead of a proper consultation. And there are many more, of course. How that works is 3 ways. So one, there's a synchronous mode where you will have like a live consultation with a medical professional. You get into a call, you get into a Zoom meeting, you get into a whatever video stream. You have that live session. It's like going to a doctor and having consultation, right? And then you have the synchronous mode where then you can just keep on sharing information about your health. Yeah, how you're feeling in your head. Have you measured your blood pressure? If you have the kit for measuring blood pressure, you share those observations with your doctor, and your doctor, at their own convenience, and then probably give you a diagnosis or give you advice. And then, of course, always monitoring. The moment you can always have a doctor on demand, right? You could go into a health tech application, look around for a doctor who is available, who can serve you for the specific healthcare need that you have, and then from there you can always have healthcare service on demand instead of going to a hospital and doing queues and all that. But then, having said that, it's important to appreciate these modes, and not just that. Fundamentally, every product that are in the market have a business around them. So knowing or appreciating the business model will determine how you're actually going to enforce governance for whatever product or service that is being offered. Remember, if you have your M-Pesa application, right? Your M-Pesa application, there are certain data sets that it needs. There's a how it uses that data. There's a how it shares that data. There's a way M-Pesa Africa provide governance for data that M-Pesa uses. And that depends on their business model. Remember, at the end of the day, the goal of any business is to make money. So everything has to help the business make money. By doing that, the reason why we need to do privacy by design is we want to help the business make money, but in a very safe, compliant, and responsible way, right? So understanding a business model is key. Of course, I've already mentioned in terms of benefits, can help you reduce your hospital visits, have on-demand access to specialists, provide you emergency care in case you need special care, because you'll find that these platforms have specialists that might not be even available within your vicinity, within your village, in your town, right? If you're looking for a cardiologist who is not in Machakos, instead of coming to Nairobi or the patient can't travel, you jump into a healthcare application and get that service, right? But having said that, let's now start looking at data. Once we've sort of have an understanding what and why of a health app, the high-level model how it's delivered, how it works, and the business model around it. Now, from a data outlook, just quickly, these are the kawaida, your usual data types that are typical health tab. In fact, a lot of applications, this is just kawaida information that they will collect. Name, they'll ask you to sign up for an account. You provide your name, you provide your email or your phone number or both, right? Remember, M-Pesa application needs your phone number. In our health application, we do not necessarily need your phone number. Again, it comes back to the business model. Why does M-Pesa ask for your phone number, not your email, your phone number? But for us, we don't mind about the phone number. We better have the email. Again, business model. You cannot have an M-Pesa app without tying that M-Pesa application to a particular identity of a subscriber in Safaricom, right? Business model. Okay? So anyway, so things like your name, your email, your phone number, home address, just the kawaida stuff. Of course, if for an application, the first thing you'll always do is to do a sign up, right? So at sign up, you can provide the credentials for registering the account, and then thereafter, you can enrich your profile as a subscriber with all the other details, your age, your nationality, etc., right? So this is kawaida data we can think about. And then of course, there are others, things like this that the application time, based on usage, the application would hold about that particular user. So your vital signs, if you're talking to your doctor and you're having the discussion and then the doctor is doing medical notes, and then those records have to be associated with your account, that means your medical vital signs will be there, medical history, health condition, your prescription, etc. Okay? Maybe two things to note, something like race and government ID. Those are very, in fact, including even religion, those are very interesting data points that even in hospitals, I mean, most hospitals you'll be asked. But again, there are reasons for example, me asking you about your race. Could it be that there are certain conditions that best diagnosed based off of your racial profile, or other medical care that can be provided based off on your religious affiliation, right? There are certain things that Indians would want that a Christian I don't mind, right? Oh, they don't want that a Christian I don't mind, right? Again, just based on your use case. But this is the kawaida data you probably want to look at. By extension, because you're collecting all this data, whether personal data or otherwise, or medical data, which both are actually personal data, some more sensitive than others, then we need to exercise some form of data governance, yeah? So first, we need to think about, this is the data we collect, right? But then how do we categorize all that data? Because not all data is the same. Different data have different value to the business or to the product. That's why they are collected for different reasons, yeah? So we need to categorize, look at our data inventory, categorize based on the nature of the data we collect, medical, financial, like I said. At some point, you probably are paying for drugs. You're using M-Pesa to pay the consultation fees. So we kind of have a bit of your financial information, right? Could we look at sensitivity levels where we're saying, okay, fine, your name is not as sensitive as your government ID, because we need to probably verify you are over 18, right? So we might think about classifying your information. And you're doing this from a very technical perspective. It's not some form or some policy somewhere. It has to be done in the application, so that the database then knows if in a certain field you're supposed to input a name, then an input name the name input would then go to an ordinary data type or ordinary data classification. But if it is government ID you've uploaded, then the database will then classify that government ID image, right, as a sensitive record, yeah? So it's a very technical, in the backend technical governance. And then lastly, of course, tagging, and that is where you kind of associate a sensitivity for data based on the nature of that data. So name, when you get that name, when you go into the application and input your name, then the system will capture that input, and then it will do tagging.
So it will tag that name field on that name input as, let's say, internal only, right? So the tagging, it will take the classification level, create a label, and tag that label to that name input. And that name input, of course, is associated now to your identity as a user. I hope that makes sense. But then the purpose of tagging, from a machine code perspective, you can then do labels like sensitivity labels, do labels like business holds, do any other labels that you need. Sometimes you might remember for data protection, there are these things we call rights, right? So all of us have rights. So you can ask a company to delete your information. But then how does a company know where your information is in the ecosystem? How does a company figure out which data to delete and which not to delete? If today you go to Safaricom and tell Safaricom, okay, fine. I want you guys to, from today, stop processing information about, let me look for a service, my statements, right? I don't want you to do anything with my statements. So what Safaricom theoretically should do, they would go to wherever they have statements, operations around statements. They can set up a tag. This tag will be of a business hold nature. So by that I mean, at machine level, at code level, they'll say, okay, fine, for this particular tag, we're putting a block. That's the business hold, eh? So no one can be able to do anything with that particular statement or any process around. So that we know not just where the data is in terms of the data stores, which data resides in those data stores, but then we've also discovered data sets. By discovery here, we mean sometimes you can have a lot of information and you don't know much of that information, that you actually have some information, right? The same way in our organizations, we have a lot of devices, laptops, devices, things that were stopped even working 10 years ago, but you don't even know they exist. That's what we call shadow IT, right? Where you have all these IT systems that no one is using. They probably were retired, but they were never disposed. Maybe they are still even connected to the internet or some database. Maybe hackers can use that to get access to organizations and wreak havoc, right? So it's pretty much the same thing. You want to discover which data we have beyond the ones that we already know or the ones that you've already mapped. Could there be other thing, what we call dark data? Could there be something out there, right? Because remember, in engineering, like developers would always do all sorts of things, right? UX guys will do all sorts of things. You know, an engineer, let's say you have 10 engineers in your organization. All of them are working on probably different modules. At some point, they have to go to the test environment, do tests, run this, run that. Some of those activities that they do, it's not audited because it's within the test environment. So there's no governance to audit or track some of these activities. What then happens? You find an engineer has done something, they have not reported, no one knows they have done it, but they have used customers' information. So what happens to that data? It's just out there lying somewhere. They know there's no controls, there's no security around it. Imagine the risks that could happen, right? So that data is a lot there, so that's why we need to discover that data and then make those data sets and those corresponding metadata available. So we know the data, we know the data meta, we have visibility on the back end, and then of course, you can go ahead and do extensibility for the metadata and then categorize that data. That's pure inventorying, pure data mapping, data flow diagramming. Again, sorry if I'm talking too technical, but the point is, bottom line is, just know what data you have and where it is and what is being used for all the time, as much as possible, yeah? So remember, for an ethical application, it is useful. It is useful, you know, to know. Because remember, you're dealing with sensitive information. So anyway, just a bit of classification. I think I've already mentioned that the better you classify your information, the better governance you will do around that information. Because you'll know if it is high risk data, then I need to provide the best level of security controls. If it is low risk, probably the same thing, right? Very boring diagram here, but it will drive the point home. I've already mentioned, you can think of it from the left, number one over there. So I've already talked about metadata. So you discover metadata. Remember, metadata files are the ones that have information about the actual data, right? So you need to read those metadata files so that you get context for the information that you have. And then from there, you can build a metadata store. So metadata store is where you have the information about the information, right? It's like the government behind the government. Yeah, the shadow government. Those are the people who have the real insights of what is truly happening in government that no one else might ever know. That's the same thing, right? So you have your metadata store here, and then thereafter you can use this metadata that you've collected here to do scans. You detect whether it's using AI or manual or just kawaida solutions. You run those scans to understand your data, build an inventory, and that's what you'll have here now. Run the scans, use metadata, build an inventory. Then this inventory will be used to decide what actions or what governance instruments or controls to put around the data. And then you can then go ahead and keep updating, and sort of the cycle goes around. One more thing to note, if you go through this process, it will help you do a bunch of compliance stuff, which is kawaida. Data retention, it's very straightforward in the law. Deletion, data subjects' rights, etc., etc. So, now that's now basics in terms of setting the stage. But let's jump quickly into how now to think how you can translate the legal, ethical, good practice perspectives into more technical considerations. So one, remember, I want to assume safely that you know at least half of the data protection privacy requirements, right? Yeah? So if you have your privacy requirements, whether by the law or by industry standards, when you're looking at product privacy and building privacy by design, because it has to be in the product, you have to think about how you are translating these privacy requirements to become technical requirements that can be engineered, right? It has to be engineerable, right? So get your privacy requirements, turn them into technical requirements that engineers, developers, product managers can understand, and then take those tech requirements and turn them into specifications. So specifications are like the granular techniques or tactics that an engineer can actually code, right? Requirements are more directives, and then turn those directives into very engineerable, frame them into an engineerable way. So this is kind of the process, yeah? It's kind of the process, do analysis of your functional requirements. Like for example, in our health tech application, the first thing we need is we need a video streaming, because we need to have live e-consultation between a patient and a doctor. It's a very functional requirement. Now, that's a functional requirement. How are we gonna do it? Because you're going to do live streams, so we need to figure out how do we then minimize, whether it is live stream, whether it is maybe payments. How then do we minimize collection and use of people's data within that function? And then of course, this is a bit more technical, but you can think about modeling how whatever threats or risk scenarios that can happen, and then figure out some of the security or governance controls that you might then implement, and then you might probably test that. Moral of the story here is, take best practice, take legal requirements, look what the law says, what some ISO standard somewhere says, translate them into a technical specification so that the developer can sit down and actually code it, period. Good things to do is things like risk analysis, threat modeling. Wouldn't discuss about those, but could be useful to do some learning on. So this kind of sets the stage of now getting into the building itself, right? So I'm taking you to a journey of, so this is a use case of a health client I've worked with there. So I'm taking you sort of the thought process that we kind of went through. But again, it's still work in progress. So once you figured out that you need to do the translation of requirements, now you can now start thinking about what is the business logic for this product we are building. It could be a fridge, like I said, a smart fridge. It's a very simple product. But every time you open, it records your data. Every time you put a box of a meal, it records your data. So it has patterns of how you access the fridge, when you eat, what did you eat, maybe it scans the room, who knows. So initially I mentioned this, it's important to appreciate the business model. But then let's move away now from that business model, probably business model canvas, and now think from a technical perspective. How does the app itself work end to end, right? So quickly, so this is you, the user. You'll come and, so this is the application. You'll come and set up an account, and then you'll have a wallet for loading money, either initially or you can load money when you need to pay, right? When you need to book for a consultation, you go ahead, book for the consultation, engage with the doctor, and then from there you can, once you have the prescription, diagnosis, you can come and do prescription review. You can order drugs. So here, of course, you also need to pay if you're ordering through the application, and then thereafter, you can do your orders review, your order card, and then this order is then moved to partner chemists who can then ship the drugs to you, the user. Again, that's just high level view of it. Most applications are like this, but of course there are others that have probably different components, or some sections are a bit more, the flow might have changed a little bit, but I'll explain in a bit. So that is high-level business logic. So let's try and sort of dig into it. This is where the engineering is. I will try to summarize so that to Melissa in the next 15 minutes. So, okay. Aya. So hapa, wacha tuanzie kwa user hapa. So I just want you to appreciate the thought process. Don't think too much of the details. So this is the user. As we said, this arrow is supposed to point this way anyway. As a user, the first thing you'll go into application, you download, you want to set up an account, right? So this is account setup. So here in this case, we have used a web portal. So this is someone who is using, probably doesn't have the app, goes to a website, wants to set up the account. This is the data types we're asking you, right? Name and email are compulsory. Phone number is optional, right? Of course, we'd want to ask for date of birth, but in our case, as I'll explain in a bit, we are not asking for the exact date of birth. Let's say it's 17/5/1990, right? We are using an alternative for using age ranges. We are exploring also another alternative of how you can only give us, instead of giving us the actual age or the full date of birth, you can only give us a verification token, instead of something that is more identifiable. Home address is optional, but it can be compulsory, right? So we're asking you to give us your home address, but it's optional when you're setting up the account. But when you do an order for drugs, you'll have to give us your home address so that we deliver for you the drugs, right? So again, depends on which stage. Of course, passwords and your username, whatever those are. For the password, we all know hashes, right? Password is hashed and all that. Of course, even from a data protection perspective, hashing does not make the data anonymous or pseudonymized. Hashing can still be reversed. But again, there are technicalities to that, so at least that's some level of protection. And then, of course, your kawaida two-factor authentication with the fingerprinting option. And then here, this is now, from a pure data protection perspective, with some privacy components would be like, we only collect name and email as compulsory. The rest is optional. In fact, the argument is that some of these fields, we could actually remove them already, right? Instead of having them optional, yeah? So the goal here is to minimize what you're collecting initially. And then just to ensure for transparency, we provide what we call a sticky policy. So sticky privacy notice. So it's a privacy notice that pops up during the sign up. So how we set it up is we are forcing you to read that policy. And how we are doing that is we give you a timer. So like 1 minute or 1.5 minutes where you cannot proceed further without reading that policy. Of course, you have the choice of not reading it, but the point is the time bound helps you at least scroll through, at least look at the key things in a privacy policy, which is important. That is good for private transparency, which is a critical principle for privacy. And then one interesting one is always the dashboard. So we have some sort of a privacy dashboard. So within your account and your profile, we can indicate for you a few things as to what, how, when, about your data. So we tell you this is what we have about you. You can always delete it, you can change it, you can do all that stuff. So again, that is set up. So what we've done here is to try and address some privacy compliance aspects, technically. And then of course, once you set up your account, your records goes to a database. So this database, a few things we've implemented here is, of course, there's encryption, some form of encryption that is there. So we are doing encryption at field level. So field level here means instead of just doing the whole database, or instead of doing tables, we are really making it as granular as we can. Yeah, as granular as we can, so that your name can be encrypted, but of course, maybe your national ID is not, or both, depending on the level. Yeah, and a few more things like access controls, masking, like I've already said, age ranges, and then also tokenization, and a bunch of others. Not so, because of time at tutaongelea. And then important thing is now the wallet. Of course, we have said that you have the choice of uploading money or not, right? But if you put money in your wallet, because you want to book a consultation fees, remember you're using M-Pesa in this case, so we have an M-Pesa API integration. So a few things we did here, if you're going to do privacy by design, remember you mentioned privacy risk analysis? You have to do a privacy risk analysis because that M-Pesa integration then has data exchange, right? You do your privacy technical review for M-Pesa API integration. You can, for example, you do map out the data flow, and then from there, you go back and figure out which controls can we put there. Of course, there is API security, which is a whole other thing that you can then use to cover this. Booking consultation, this is now where you go into a session with a doctor. Remember, it could be either video, audio. Of course, if it is video, it is both. So how this works is, you go into the application, you decide, I want someone to treat me for dental, right? But because not all doctors on the platform are dentists, so we'll say, specify, I want a dentist, this is my issue, specify which time you can be available for consultation. And then if a dentist is available for that time, they can be able to confirm your appointment. And then thereafter, you block your calendar on both sides, both the doctors and the customer, and then you can have the consultation. But one interesting thing from a privacy perspective here is that for the doctor has no visibility of the actual patient's information, right? So each patient has a unique ID. I mean, kawaida ID. Each doctor, the same thing, has a unique ID. So what the patient will see is a doctor's ID, and what the doctor will see is patient ID. And of course, this is randomized, right? These are tokens of randomized information. But at the end of the day, even patient ID is personal data. Even doctor's unique ID, even your employee ID is still personal data, right? So again, same controls from a technical perspective comes into play, but then the most important is the visibility, minimizing what the doctor can see and what the patient can see from both sides. And then of course the doctor will issue prescription. If it is a video call, clearly if it is 5 minutes or 10 minutes, with all sorts of, daktari anakwambia nionyeshe mkono, nionyeshe huku, blah, blah, blah. So imagine the level of sensitivity of those videos, right? Because they are records. So then how do we keep all that information? So we push those to a secure storage hopper. So we are using Amazon, so Amazon Web Services. So we're pushing that to the storage. This storage is small. It's set up like a vault. So vault level security basically just means is the strict test. Is it strict test? Wow, strict test. Level of security you can at least as per the capabilities. Okay. So that ensures a very good level in terms of the storage for the recordings. But then most importantly, we only store them for 7 days, unfortunately. Because remember, they are video, they are large in size, so we can't have too much space. And then at the same time, they're also critical and very sensitive, even though, even from a medical perspective, medical professionals will tell you, you need to store health records for a long period, 10 plus years, unfortunately. But I think maybe that's something to explore. Do we want to behave as kawaida hospitals, or can we just chart our own way? Yeah, I mean, store a recording for 7 days max, delete it, or if not deleting it, then there's the option of pushing it into a super cold storage, which again costs money. So again, those are the discussions that are here. Yeah, and then the rest sort of flows. Oh, one other thing, very critical from my medical perspective. Remember, the doctor will take notes, offer prescriptions, all sorts of things related to that. So all of these things also have to be stored. So as I initially had mentioned, digital health is a super critical conversation happening right now. And the critical aspect of digital health is what we call EHR, electronic health records, right? So this is sort of where we store, of course, the videos are still records, medical records, but these doctors' notes or doctors' prescriptions, we put them sort of in a separate storage. Again, vault level security that are then retrievable by the patient. A bit of it is retrievable by the patient, but then also accessible to the doctor who offered the prescription. So that's on the storage side, and then now we have the rest where the user can load the wallet, order for drugs. When you're ordering for drugs, so our model is this, that we've partnered with some other external parties, third parties, chemists. So we have to share some information with these chemists of our customers. So how this will work is, when a user who has seen the doctor and they have a prescription want to order drugs, they will go to order drugs, click a button, go to order drugs, right? And then we'll tell them, they can then give information of the drugs they need based on the prescription, yeah? Or they can actually share a photo of the prescription or the doctor's notes, upload that copy, so that the chemist on the other side or whoever is there can be able to read those prescriptions and provide the drugs that are needed. But two things I want to mention here is, one, when someone is going to actually order drugs, we shoot them with another privacy notice. Remember earlier I mentioned you do not have to give us your home address. But at this time, we would want to have your home address because we want to deliver drugs, right? So we'll shoot for you a notice about collection of your home address. We'll also shoot your notice about sharing your data with an external party. Very, very, very granular information for transparency's sake, which of course what we do, we share the first name of the user. If they have given the address, we share the address, but not the precise address. Let's say you're telling me unaishi Nyayo, phase 2, block C, house number 3, or 4th floor, house number 3, right? Not that kind of information. So we're using what we call k-anonymity. So k-anonymity is a privacy enhancing technique where you make things as aggregated as possible, right? So instead of, let's say, wow, I'm looking for a street. This street in Aituaji. Westland Street, Westlands Road rather, Westlands Road, Chiromo. Anyway, so there are like 5 or 6 levels with which you can define a location. So your country, your county, your name, your town, as you go like that, street name, building name, house name, floor name. So what you're doing, you're keeping it high level, so that if you order a drug, tutasema inakuja Nyayo, But we don't know Nyayo which block. We don't know Nyayo which house. We don't know Nyayo which face, right? We just know it's Embakasi Road. Off of it, you go to Nyayo Estate, right? So what then happens is the rider, so the contracted rider can then access that high-level address and access at least your contact. At this point, you have to collect your number. Only if you order drugs, we want to collect your number. So the rider would be able to get in touch with you as a user, but they don't call you directly. It's like Uber, you know. Someone can choose to call you in app. So that's the idea. So they can call you in app, but they don't have your exact address. So it's your choice as a user whether you want to meet them in a mall and not your house, or whether you want them to come to your house and not meet them somewhere kwa gate. You know, so we are leaving that control. We're giving back that control to that particular user, right? And that's what privacy is about: control and agency. So yeah, so this can then, the trust can then be shipped back to the user. So that's kind of just a general, without going into much detail. Kiongozi amefika, time najua inaenda kuisha. Anyway, the core thing to take away from this one today is this note up here. So the architecture can be different for any product you're working with, whether it's an application, a web-based application, a hardware application, whatever you want to do. But this is key. All products, particularly the ones that have digital components or smart components, have some form of architecture. So think of architecture as a privacy tool, right? Think of architecture as a privacy mechanism, as a privacy opportunity, right? How do we architect in such a way that we comply even without thinking too much about the law? When the law comes, itatupata kama tushaenda, yeah? Anyway, that's that. Najua time imeenda. We have 10 minutes. Tumaliza. Hapa inaenda ikiongezeka. Aya, wacha ni summarize basi. Oh, 10 minutes. Aya, sawa. That's the beauty of too much content and passion. One thing to note, nikimaliza, I wouldn't finish the whole thing, but ni sawa. So we've talked about designing and diagramming and figuring out privacy requirements into technical and all that. Let me jump here kwanza. So there are these things we call microservices. So basically this is just like modules. Fikiria tu kama modules. Sahi ukiunda fridge, si fridge kuna ile kitu inakuanga na the vacuum na nini inatoa maji. There's that section, eh? Wacha tumie gari. So gari iko na body, gari iko na engine, na gari iko na the rest of the components, right? Yes. So you could think of it in that way. So there's module 1, 2, and 3. So if you're building an application, for example, this one. So the thinking is that you see all of these key things like registration, consultation, e-storage, this one, yeah? These are different modules. Instead of calling them modules, you can call them microservices, yeah? So it's just like having module 1 that does this specific function, module 2, this specific function, like that. So that then brings me to this thing here. So how to help with privacy compliance is this. When you decentralize or rather separate functions of a product, right? Where you're saying, hii module itafanya hii na hii na hii, and these modules are separate. They might be interconnected, but very loosely, very, very loosely. On demand, kama ni lazima, they'll be, of course, very loosely connected. So what that means is that whatever module 1 is doing, it's not about, module 2 doesn't care, and vice versa, right? It ensures that there's not too much data flow between these two things. So we are isolating our data processing so that when you apply controls to maybe module 1, the level of controls might be different from module 2, right? Or 3, etc. So that separation is a good thing for architecting. And then packaging, how we then sort of wrap these functions or these services would help us to ensure that we provide the right governance controls. And then lastly, of course, guarding is just basically just protecting everything around the microservices. And how that then comes into play is we want to have principles. We all talk about data protection principles. Then privacy by design. So what you're looking here is, we want to relate how microservices, the qualities of how we are setting up our infrastructure or our microservices, to some of the privacy by design principles. We have to match them. So you're matching the practice, legal requirements, versus the engineering objectives. And that is the challenge, again, I think with privacy by design is, engineers don't care so much about compliance. In fact, it slows them down. Engineers want to build, and ship, and go to market. While we compliance people, we are here telling engineers, we want to do safe, we have to achieve this, we have to achieve that. So there has to be a middle ground. And how do you do it? You have to figure out governance principles, engineering objectives, and then align those. So that's kind of what this does here. If you're saying, for example, for privacy by design, we want to embed privacy into the design. By doing this, to achieve this objective, we can then use these 3 techniques in terms of how we are architecting. For example here, if we apply the 3 techniques, we'll then achieve privacy as a default. Here, for example, we have 1, right? If you're guarding, then you're providing security for that data. So depending on your mix and stuff, I think that can help you think about how you're designing, architecting and designing the concept of your product, vis-a-vis principles. Remember, principles don't change. Practices do change based on maybe a framework, which framework you're using, which standard, but principles remain the same. So work from a first principles level, right? Take the first principles approach. Acha niachie hapo. I can talk the whole day. Asanteni. I hope you are confused and you have more questions to go and research on. Thanks. Question. There's one. No. In fact, because you're inakuja before, you're inakuja before because it comes more like at the conceptualization level. The ideation and the definition of the ideas and all that. In fact, naona sasa hii. See this section here. This in a sense conceptualization. So, of course, if you, as a let's say an entrepreneur, you want to run the full mile. You would probably want to do use the HCD approach to define your idea, right? So that's why, of course, you need to come here and do the surveys and talk to people, do focus groups, nini. So that comes prior before we start doing the architecting and nini. So here it's just more like for engineers, but engineers from a business perspective. But having said that, of course, I think the beauty about privacy is it centers the data subject, in all of it. This privacy thing is about we the people, we the users, yeah. So if you focus on the principles, in a sense, a lot of it will be favoring and inclining to the user at the end of the day. But yeah, good question.